Roughly 287,000 coronavirus hospitalizations this summer were preventable. That's according to new analysis by the Kaiser Family Foundation. It found these hospitalizations cost billions of dollars and could have been avoided with vaccinations. But the pace of first dose shots has been slowing since early August. And as Manuel Bojorquez shows us, the summer surge is still in full swing.
There are more signs tonight of COVID's worsening grip. Both cases and deaths nationwide remain dangerously high, equal to levels from last winter's devastating surge. The latest hotspots, West Virginia, Pennsylvania, and Tennessee. In Florida, one of the nation's hardest hit states, Governor Ron DeSantis is not just pushing back against the Biden administration's call for vaccine mandates. He's doubling down.
If a government agency in the state of Florida forces a vaccine as a condition to employment, you will face a $5,000 fine for every single violation.
According to one analysis in June, less than 10% of hospitals in the U.S. were at or near capacity in their ICUs. Now, 1 out of every 4 hospitals has at least 95% of its ICU beds full. The problem is worse in the South. In Florida, 24 hospitals are reporting more patients than available beds. Many are suffering from COVID, the vast majority unvaccinated. One consequence of that, Florida teacher Nathaniel Osborne had to rush his 12-year-old son Seth to the emergency room in July. He had appendicitis. There were no beds, and his appendix ruptured as they waited more than 6 hours.
Quivering in pain.
I can't imagine what that's like for a father to see.
My wife asked, "What's going on? Why did we have to wait so long?" And the nurse rolled her eyes and said something to the effect of, "Well, what do you think? We're slammed with COVID."
Seth spent 5 days in the hospital but has since recovered. The number of COVID patients in Florida hospitals has gone down, but it's coming down from record highs. So some emergency rooms are still stretched to their limits. Elaine?
Manuel Bojorquez, thank you. For more, let's bring in Dr. Richard Besser. He's the president and CEO of the Robert Wood Johnson Foundation and the former acting director of the CDC. Dr. Besser, welcome. As we just heard, ICUs in 1 of every 4 hospitals in the U.S. have reached at least 95% capacity. How dangerous is it to carry this surge into the fall?
You know, Elaine, this is huge, and it's really important that when we think about the burden of the COVID pandemic, we think beyond just the needs of hospitals to care for people with COVID. People every day have health crises. They have heart attacks. They have other issues that require quick care. And there's a whole load of people who need to get screened for cancer, people who need to have joints replaced, people who need other operations. When all of our healthcare resources are directed towards one condition, controlling COVID, it doesn't leave room for all the other things our healthcare system needs to take care of. And it's so incredibly tragic, since so many of these cases of COVID could be prevented if people would get vaccinated.
Well, more than 243,000 new pediatric COVID cases were reported to the American Academy of Pediatrics last week. It comes as kids return to classrooms for the new school year, and many parents are concerned. How safe are classrooms really for children, especially those children who are too young to be vaccinated?
Yeah, you know, I'm a pediatrician and I'm a parent, and I'm really thrilled that this year we are focused on keeping children in classrooms learning as much as possible. But to do that safely, we need to make sure that schools are doing the things that have been shown to reduce transmission. And that means ensuring that everyone is wearing masks, that there's social distancing, that ventilation has been addressed by simple things such as opening the window, that you're requiring people to be vaccinated, and that you're implementing testing. The CDC recommends in areas where there's significant or high levels of transmission that there be routine and regular testing programs for anyone who's not fully vaccinated. And that's something that we're not seeing in a lot of places, and it could go far to make it safer for kids. I expect that this fall we're going to see a lot of schools that have to shut down briefly, but hopefully with testing, and hopefully if more and more adults roll up their sleeves and get the shots, we can keep kids in school much more than we otherwise would this fall, which is where they belong.
Well, health experts say data on a vaccine for children ages 5 to 11 could be available by late September or early October. Now, that data will then head to the FDA. Doctor, what time frame are we looking at for emergency use authorization, and what factors might change it?
Yeah, I mean, that's a really important question. Until we have vaccines available for everyone, and that includes children under the age of 12, it's going to be very hard to get this pandemic fully under control. But in order to have vaccines for children, you want to make sure that the FDA has the time to thoroughly review the data, to make sure that the vaccines are safe and effective. And that's really important, since the younger you are, the less likely you are to have severe infection, the less likely you are to be hospitalized or to die from COVID. And so if you're primarily vaccinating children to prevent transmission in the community, you want to make sure it's safe. And as a pediatrician, I want to see that they've been able to make those deliberations, that the advisory committees to the FDA that look at that information, make recommendations, that they've been able to do that without political interference, looking at all the information, and that the advisory committee to CDC that eventually recommends who gets vaccines, that they're able to do that in a thorough manner. Without that, we won't see that many parents wanting to bring their children in. And if we have safe and effective vaccines for kids, it's critical that people are going to want to use them.
Well, a review published Monday in The Lancet and co-authored by top FDA scientists concluded scientific evidence does not support the need for booster shots for the general population. Dr. Besser, we've been hearing a lot about boosters. How should we understand this review, and what else did researchers find?
Yeah, I think that the administration got a little bit ahead of themselves on this when they announced that vaccines, boosters would be available beginning September 20th. It's great that the planning's in place so that if these vaccines are approved and recommended as boosters, the systems are in place. But it's really important. Next week, the advisory committee to the FDA, next Friday, they're going to be looking at the data on boosters and making a recommendation. Likely, they're only going to have data to be able to look at boosters for people who've had the Pfizer vaccine. But I want to make sure that they look at that data independently without a lot of pressure. The report in The Lancet, this is from led by two people who worked at the FDA, who had a lead role in improving vaccines. Their conclusion is that booster shots are not ready yet for people. They're not indicated. A study that's just out in the New England Journal with Israeli data suggests that there may be a role for boosters. So looking to see, is it the time now for boosters? If so, who should they be recommended for? What do we know about the safety of boosters? What do we know about a booster shot for one person who received one vaccine with the vaccine from another company? There's a lot of questions here that you want them to be able to sort through to be able to provide guidance for people before the rollout of boosters. And I don't think we're there yet. I think it will be a couple weeks before we're really able to say how to move forward on boosters.
So adding to this discussion, Dr. Anthony Fauci says he mostly disagrees with this, quote, controversial article, saying that you can boost your own population while also helping low and middle income countries. And he adds there is evidence of waning immunity in the U.S. So, Doctor, what do you say to that?
Well, I think there are a number of opinions on this, and that's why you really want the independent advisory committee to be able to look at the information. The World Health Organization is not recommending that countries move forward with boosters right now. And the reason for that is that 80% of the vaccinations have been going to wealthy nations, only 20% to lower income countries. There are many healthcare providers around the globe who don't have access to vaccines. And this pandemic will not be under control anywhere until it's under control everywhere. The Delta variant was first identified in another country, and it's very likely that there are going to be additional variants that crop up. And so it's important that vaccines are allocated in such a way that there's fairness around that there's equity, that we're able to get this under control, not just in the United States, but in other countries as well. I think that Dr. Fauci is right, that we're going to need to be able to do both, ensure that we address the needs of people in America while doing much more than we currently are to help support the needs of people around the globe. And how we do that, the Biden administration is looking to convene a global summit on how to address the global issues. But there's so much more that wealthier nations need to do to ensure that vaccines are provided to people everywhere.
So the CDC is planning a summit for local health officials this December, and it will focus on the COVID-19 pandemic and how to, quote, strengthen the public health system. In your opinion, doctor, what are some of the biggest lessons that officials are learning right now, and where is there room for improvement?
Well, I mean, there's so many areas for improvement. I think what we're seeing broadly is that if you let your public health system deteriorate, if you don't support it in terms of personnel, if you don't support it in terms of its data systems, in terms of its laboratory capacity, when a health crisis comes along, it's very hard to play catch up. You know, we've seen during this pandemic disparate impacts on people by race, by ethnicity, by income. We've seen public health data systems that haven't even been able to capture that information. And if you can't see clearly where the problems are, who's being hit the hardest, it's impossible to direct resources appropriately. So I'm glad the CDC is convening that, and hopefully it will lead to resources coming from Washington that are sustained, that don't allow our public health systems to atrophy in the way that they have, and really recognize that we have an important role to support public health here around the nation as well as around the globe. We let that atrophy as well. And I think in many places we're caught by surprise at how rapidly this pandemic spread around the globe.
You make a really good point about the need for just basic foundational data, because without that, just identifying disparities in health outcomes and how it is that different populations are affected in a pandemic, we know from what's happened how valuable and important and critical that information is. Dr. Richard Besser, thanks very much for sharing your expertise with us.
My pleasure. Thanks for having me on.